This is revision gynecomastia surgery with areola reduction and removal of excess tissue. Good morning, guys. Today we're doing revision gynecomastia surgery. Now this patient had gynecomastia surgery about 3 years ago with liposuction and excision of the tissue. He'd had some weight fluctuations as well, and that left him with areolas that are a little bit low and a little bit too large. He underwent a revision on the right side about 7 months after his other surgery by the same surgeon, where he had just a crescent lift. And now what a crescent lift is, where they just take out literally a crescent of skin on the upper part to try and pull the areola up. It's not a very good technique for lifting the nipple, and it leaves the areola more elongated. And so you can see here now, he's got a really good physique, really good pec contour, but his areolas, they're a little bit excited right now, but they're just too big, and he's got too much areola below his pec border. Not to mention as well, on this side, he still has some residual tissue here in this lower part that's kind of causing this to go out, in, and then back out. Whereas on this side, he doesn't have that. This is just a nice pec contour out to in. So my plan of attack is, one, I got to go in and take out this extra tissue. And so that's going to cause this to go back in, and that'll be nice. But then he needs an areola reduction as well. His areolas, when they're fully relaxed, they're about 5 centimeters in diameter, and that's just way too large. They need to be about 2 to 3 centimeters. So I'm going to reduce this by over 50%. The other thing I'm going to try and do, which is not very predictable, is to make this a little bit higher, bring this up higher on his pec. Now, the technique of areola tightening and areola lift, just keeping the scar around the areola, is not the strongest areola lifter. However, it's the only one we got to avoid any extra scars on the rest of the chest. So, gonna go in, make it a little incision here, take this tissue out, and then make the areolas smaller and try and get them up a little bit higher. But that's not a guarantee, that part, but it's going to be so much an improvement in the overall balance of his areola size to his chest contour. I think he's going to do great. So I'm going to do the markings. In these cases, I do a lot of the markings on the table, but I'll do some cursory markings now, and then we'll head over to the operating room, and I'll see you guys in there. So we're here in the operating room, and he's laying down. I want to show you guys something here. These are his areolas when they're fully relaxed. And so when I do this measurement here, his areola here measures about 45 millimeters or 4.5 centimeters. And this way it measures about 4 centimeters. And so that's way too big. I need to bring that down to about 2.5 centimeters. And then the other thing that I'll show you here is that he's still got this fullness here that he doesn't have on this side. So I got to get this out, because if I don't get this out and I just do the areola tightening, it's going to push all this tissue up under his areola and cause it to do that, almost like he's got grade 1 gyno. So first thing is, I'm just going to mark out my areola reduction, but first thing I'm going to do is take this tissue out and then do the areola reduction, and then we'll be done. So let me show you guys something. So his second surgery with that other surgeon was to do what I call a crescent lift. And that is this scar here that he's got. You can see this faint scar that goes from here to here. And what they do is they take like a crescent moon piece of skin out, and then when they close, it pulls. But what happens almost always is it doesn't lift the nipple very much, but it stretches the areola. You can see his areola is not round, it's more like an egg shape. And that's because it's being pulled in one direction. And so if you really want to try and pull the nipple up or do some kind of areola movement, you really got to make the incision all the way around. So I've already done the markings. This is going to be the new size of his areola. I'm going to make this incision, make this outer incision, remove the skin in between, and then when I close, it's going to obviously make the areola smaller, but because I'm taking more skin in the upper part compared to the lower part, it should shift the areola up a little bit. Now, like I said before, it's not that strong of a areola lifter. What this technique is really good for is tightening skin and also making the areola smaller. Whatever he gets as far as areola lift is what he's going to get. You can't make this circle, this outer circle, too big to try and lift the nipple up higher, because then it's too much skin taken out, and then when you go to close, it's going to be too much tension. Not to mention, it's going to pleat everything, which is not going to be aesthetically good. So there's only a certain size you can make this compared to the size of the areola. So long discussion. The other one thing I want to mention, he needed 2 surgeries. I usually, when I'm doing these gyno cases with guys with large areolas, I do the areola reduction in one stage, and that sets me apart from other guys who are doing this surgery. If you don't do it right, you're not going to have much risk for blood supply issues. And so I typically do these in one stage. And in fact, my next surgery is exactly that. It's a gynecomastia surgery with an areola reduction at the same time. This is the new areola size. This is the skin I took out in between. You can see I took more skin out up here than down here, so that when I go to close this, hopefully it'll bring it up a little bit. But the goal is now to get this outer circle to this inner circle, and this is why this is a more powerful thing than just doing a crescent lift, because this is tightening it and reducing the areola 360 degrees as opposed to just 180 degrees. Completed this revision gynecomastia surgery with excision of tissue from the right side, and then an areola reduction and a little bit of an areola lift as well. And you can see he had a lot of tissue on this side, and so that's probably a combination of scar tissue and breast tissue, a little bit of fat. But let me point your direction towards the areolas now. Before, remember, this one was about 5 centimeters in diameter, and so now when I measure it, 23 or 2.3 centimeters, so over 50% reduction. And not to mention as well that this areola before was below this pec border. So he had areola down to here. So I did accomplish a bit of a lift as well to make sure that I cleaned up that areola, and so he had no areola below his pec on each side. So he's going to do great. This is a much more proportionate areola to his overall chest size. This contour down here is much better, so he doesn't have that bulge down here because this tissue is gone. I just have to put the dressings on now and get him to recovery. He's going to do great. Until next time, guys.